Hello, CNA students. This is Instructor Cersei, and here is the California CNA exam list of room equipment and furniture. We start with adjustable bed with side rails, used for patient positioning, comfort, and safety during care. Head elevation helps with breathing, eating, and prevents aspiration. Side rails provide fall prevention and support for patient mobility. Wheel locks ensure bed stability during transfers and care procedures. Chair. Essential for patient mobility and rehabilitation. Used in transfer skills from bed to chair. Provides seating for patients who can sit upright, and is important for maintaining patient dignity and normal positioning. Next, we have the bedside table. It stores personal items within patient reach. It holds necessary supplies during care procedures. It provides surface for meal trays and personal belongings. Overbed table. It's an adjustable surface for meals, activities, and personal care items. It allows patients to eat in bed safely. It provides workspace for CNAs during procedures. Now we have monitoring and safety equipment. Clock, wristwatch with second hand. Critical for taking accurate pulse and respiration measurements. Used for timing procedures and medication schedules. Essential for documenting exact times of care activities. Scale, calibrated, non-digital. Monitors patient weight changes indicating health status. Required for accurate medication dosing calculations. Helps track fluid retention, nutrition status, and treatment effectiveness. Signaling device, or COLITE. Ensures patient safety by providing emergency communication. Must be within patient reach at all times. CNAs must respond promptly to calls for assistance. Now we go to hygiene and personal care. Sink with hot-cold running water. Essential for hand hygiene before and after patient contact. Used for cleaning equipment and supplies. Required for various personal care procedures. Bath towels and washcloths. Used for bathing, personal hygiene, and maintaining patient dignity. Provides warmth and comfort during care procedures. Essential for infection control through proper drying. Bath basin. Used for bed baths when patients cannot use shower or tub. Holds warm water for bathing procedures. Helps maintain patient hygiene and comfort. Soap, liquid, hypoallergenic, unscented. Prevents skin irritation in sensitive patients. Maintains proper hygiene standards. Pump containers reduce contamination risk. Lotion, hypoallergenic, unscented. Prevents skin breakdown and dryness. Essential for elderly patient skin care. Applied during daily care routines to maintain skin integrity. Now we go to linens and comfort items. Bed linens, fitted flat sheets, pillowcases. Maintains clean, comfortable sleeping environment. Changed regularly to prevent infection. Proper bed making is a fundamental CNA skill. Pillows and supportive devices. Provides comfort and proper body alignment. prevents pressure sores and contractures. Used for positioning patients safely. Linen receptacle. It prevents cross-contamination of clean and soiled linens. It is essential for infection control protocols and maintains organized work environment. Now we go to elimination and toileting. Toilet, bedside commode. Assists patients who cannot walk to bathroom. Maintains dignity while providing necessary elimination assistance. Must be clearly labeled for infection control. Bedpan, standard. Used for bedridden patients' elimination needs. Essential for patients with mobility restrictions. Requires proper positioning and privacy. Toilet tissue. Basic necessity for patient dignity and hygiene. Used in all elimination assistance procedures. Now, let's go to medical equipment. Manual blood pressure cuff and stethoscope. Takes accurate vital signs measurements. CNAs must be proficient in manual BP technique. Digital devices not allowed for certification testing. Measuring container. Accurately measures fluid intake and output. Critical for monitoring patient hydration status. Used for specimen collection. Transfer, gait belt. Ensures safe patient transfers and ambulation. Prevents falls and injuries during mobility assistance. Required safety equipment for many procedures. Now, let's go to infection control supplies. Gloves, large disposable non-latex. Primary protection against disease transmission. Used for all direct patient contact. Non-latex prevents allergic reactions. Hand sanitizer and hand wipes. Provides hand hygiene when soap or water are unavailable. Quick disinfection between patient contacts. Essential for infection prevention. Antimicrobial spray wipes. Disinfects equipment and surfaces. Prevents spread of healthcare-associated infections. Used for environmental cleaning. Isolation gown. It protects CNA clothing from contamination. Required for patients with infectious diseases. Must secure properly to be effective. Nutrition and feeding. Food, 2 varieties, and beverage water. Used for feeding assistance skills. Must be appropriate texture for safe swallowing. Demonstrates proper nutrition support techniques. Meal tray with name card. Ensures correct patient receives appropriate diet. Prevents dietary errors and allergic reactions. Maintains patient identification protocols. Disposable spoons, cups, paper plates. Safe feeding utensils for assisted feeding. Reduces contamination risk and is appropriate for patients with swallowing difficulties. Clothing protector, bib. Maintains patient dignity during meals. Protects clothing from spills. Essential for assisted feeding procedures. Now we go to mobility and transportation. Wheelchair with foot rests. enables patient mobility and transportation. Footrests prevent injury and provide comfort. Essential for patients who cannot walk independently. Privacy curtain, screen, maintains patient privacy and dignity, required during personal care procedures, creates appropriate boundaries in shared spaces. Now let's go to specialized care items. Denture care supplies, brush, cup, dentures, toothpaste. Maintains oral hygiene for denture wearers. Prevents oral infections and maintains nutrition. Requires special handling and cleaning techniques. Knee-high elastic stockings. Prevents blood clots and improves circulation. Applied properly to avoid circulation problems. Important for bedridden or immobile patients. Mannequin with female genitalia. Used for practicing perineal care skills. Allows skill demonstration without patient involvement. Essential for CNA training and certification testing. Documentation supplies, pen, pencil. Records vital signs, observations, and care provided. Legal requirement for healthcare documentation. Maintains communication between healthcare team members. Now, this equipment list represents the fundamental tools CNAs need to provide safe, dignified, and effective patient care while maintaining proper infection control and safety standards required in California healthcare facilities.